Good morning, and thank you so much for joining us for this edition of SBB University, where the team from Physical is taking over the panel discussion. So excited to have these 5 dynamic folks with me today. We're going to do some introductions to get started. Dr. Hinds is in my left-hand corner here. How are you this morning, Dr. Hinds?
I'm doing well. How are you?
Thank you so much for asking. I'm doing fantastic. So tell me a little bit about yourself and your background.
Sure. So I've been with Physical for about 4.5 years now. Ever since I started with them, I developed a really strong passion for the treatment of patients with balance-related issues, dizziness, vertigo, concussions, you name it. I think that really stems from my prior history as a cheerleader growing up, and I've actually experienced a lot of concussions in my past. And so I too have had dizziness related issues and balance issues that I've had to work on. And some of the most successful treatment I've actually had is when I started as a PT with the company and went through the type of paradigm and treatment that we use regularly on people. It's when I started doing that I noticed the biggest difference in myself. And so I think that's where my passion for this field really comes from. I love to talk to the community, so I'm really excited to be here today and talking with you, just because, as we know, balance is extremely significant, and falls are just extremely common as people continue to age. And so, trying to raise awareness in our community that, yeah, that balance it does worsen as you age. That is true, but there are things that can be done to help prevent you from falling. To me, that's extremely important to help teach the community about and show them ways that we can help them, so that way we can hopefully reduce that number of people that continue to fall each year.
Absolutely. It really is a serious threat. And people don't realize how hard it is to bounce back from a fall, and how many people don't realize the simple things they can do to make sure that they are not falling. So I can't wait to hear your presentation. All
Yeah.
right. Next on the docket, we have Dr. Hamer. How are you this morning?
Doing great, thank you.
Tell me a little bit about yourself, your background, and what led you to Physical.
Well, I've been around for a while, and I came in contact with some of the leaders within Physical a few years ago, particularly on the education route. So my role at the moment is directing one of our larger centers here in Southwest Florida, where we have a large population that is balance impaired, vestibular problems, and so on. But we also have a lot of orthopedic problems, total knees, and so on. So tying that into the education has been important. And Physical has a great education program where any successful franchise is trying to build consistency within the brand. And we have a pretty well proven paradigm and a high success rate. And our job really is to get that out to the other businesses throughout the country. We have 400 across the country. So it's tying in the education component in with the clinical, which is what we have, down here in Metro. So going further back from that, it's really been physical therapy either in New Zealand and Canada and here in the US. So we're lucky to be able to sort of bring sort of what's best around the world and bring it here to Southwest Florida.
And what a good place to bring it. We have a lot of seniors here in the area, and we're so excited to have such an amazing partnership with Physical and all of you here on the panel today. So thank you so much for joining us. All right, next on the docket, we have Mike Compton. How are you this morning?
I'm doing great. How about yourself?
I'm so good. Thank you so much for asking. So tell me a little bit about yourself and your background and what led you to the field of physical therapy and joining Physical.
Definitely. So I came from the Chicagoland area. I actually owned my own CrossFit affiliates before I came down to Southwest Florida. I was looking to, transfer down here, and I met Virginia Reed, and they were looking for a new regional director of wellness. And that's how I found this opportunity and came on board. And she really sold me on finding that the unique aspect of helping physical therapy patients, find a better route of health post-therapy at that point, so they don't end up back, with reoccurring issues. And I've been with Physical for a little bit over a year now, and it's been a great opportunity and experience so far, and really working on helping people to get better with their health.
Perfect. Well, that leads us to Dr. Reed. Good morning, Dr. Reed. How are you?
Oh, you muted, Jenny.
The quote of 2021. You're on mute.
Oh, goodness. Sorry about that. Thanks. Hello, everyone. Nice to be here. I am Virginia Reed. I am regional director, one of the regional directors for the Southwest Florida Clinics for Physical. I got into physical therapy because of injuries myself, kind of like Morgan did. I was a basketball player. You wouldn't know it if you saw me standing up because I'm 5'2" on a good day with my big shoes.
Oh, wow.
But I was fierce and fast and had 2 ACL reconstructions and had to have physical therapy in high school. And that kind of led me to the physical therapy route. It wasn't until I was in my last year of physical therapy school did I really start to understand vestibular disorders and get a little bit of a passion for that. I will date myself. That was back in 2004. And after that, I quickly started getting certifications in vestibular disorders and started treating that around 2006. And once we became physical, I've actually been with physical before it was physical.
Oh, wow.
So Florida Fitness and Rehab bought into physical in 2014, but I've been with them since 2004. And yeah, you never think your first job would be your last job, but when you're with a good company, it just might be. But I started specializing in vestibular disorders since that is something that physical really focuses on. It was the perfect place for me, and I've enjoyed it ever since.
Perfect. Yeah, I know how you feel about your first job being your last. That's really cool. All right, Dr. Berry, you're up. Last but certainly not least, how are you this morning?
Good morning. I'm good.
Wonderful.
So,
Tell me a little bit about you.
Yeah, I came from Minnesota about 5 years ago and started here about 4.5 years ago. I was a traveling hospital audiologist for a long time and loved what I did, but really saw the need for vestibular rehab. It just wasn't in our area at all. People were very debilitating and having to drive a long ways to get really any help in that area. So one day, just by chance, somebody told me to call Dr. Reed, and we immediately realized that we had the same compassion for patients to do whatever it took to help them. And I have loved physical. I love their concept of, before physical started, the actual medical community did not understand the difference between vertigo and balance. And have really developed that. And as a result, we see very difficult people that have often suffered for many years. And that have been really intriguing for me. I, like Gavin, have kind of been around a long time. So it's really cool in my last job to make a difference and really learn about something that was new and really making a difference in the medical community. So that is really exciting for me.
Yes, absolutely. And I think what this all leads back to is there's a lot that balance that physical focuses on that will either fix, maintain, or help understand balance in the vestibular system as a whole. So Dr. Reed's name keeps getting mentioned. I think that she plays a very critical role in what you guys are accomplishing. So let's start with that, because just like you said, Dr. Berry, a lot of people don't realize the difference between vestibular and a lot of other, things that can affect your balance. So let's start with, what is the definition of vestibular therapy, Dr. Reed?
Well, vestibular is inner ear, basically. And so vestibular therapy would be the therapy for the inner ear. And what the inner ear does is it tells your brain where your head is in space. Okay? When we're young, we're doing a lot of flips, we're running around, we're rolling in the grass, we're up and down off little bean bags. I mean, we're just constantly moving. And when you're constantly moving like that, your vestibular system usually stays very intact and very astute, and your brain knows where you are and that kind of thing. As we age, we don't do that anymore. We do
not.
Try to protect our joints. We turn on night lights when we're in the dark. We take away throw rugs. We do everything that we can to use either our vision or our touch sensation in our feet to know where we are. And by doing that, we get kind of a disuse atrophy sometimes in the ear because you're not using it as much. Just like your muscles, you get disuse or atrophy in your muscles and weakness if you're not moving and you're not getting up and walking and things like that. Mm-hmm. And so the same thing can kind of happen to your ear. But a lot of people have a hard time distinguishing balance and vestibular, okay? Usually if there is something wrong in the inner ear, you will get either a room spinning vertigo that then later kind of turns into more your head spinning, okay? And that's when something happens to one side of the ear, the brain gets a message saying, ooh, something's not right. And that difference between each side sends your eyes spinning sometimes, which sends the room spinning, and you get more of an objective vertigo. And so that's kind of the difference. Do we need to tackle that, or is there just a disuse atrophy? Because that room spinning vertigo can be either a mechanical problem, if people have ever heard the little crystals in the inner ear. Yep. It can be mechanical, where something's in the wrong place and we have to move it to the right place. Or it can be nerve related, which is usually from a virus. And it could also be migraine related. It could be a lot related, but even there are links now with the COVID-19 virus and vestibular neuritis or problems with the vestibular system. When that goes untreated, yes, you have balance issues because one, the world doesn't look right. It's hard to function in it. But two, your brain kind of does a 180 and tries to shut that system down because it's getting an abnormal signal, but that causes that brain fog. You hear people talking about difficulty multitasking, difficulty just kind of reading, difficulty in busy environments, difficulty in the car, functioning, that kind of thing. Mm-hmm. So that leads us to work on the balance aspect through the vestibular system. So we work through sensory reweighting in the brain to get your brain listening to the vestibular system and the other systems like your eyes and your touch correctly to help your overall balance. But when we talk about balance, it could be from an orthopedic problem because you have weakness in your legs and you can't keep yourself from falling. Your strategies aren't there. Or it could be a sensory related issue from either the vestibular system, the visual system, or the somatosensory system, which is like people with neuropathy and they can't feel their feet. Does that make sense?
It does. And I think it really leads us into Dr. Berry, when we're talking about audiology and how does your hearing affect balance? And talk to me about that link between your balance and memory.
Well, going just to the basics, the auditory nerve has two functions, hearing and balance. So of course it is related. Mm-hmm. So there are people that have perfect hearing that have vestibular problems, but there are also people that have vestibular problems that it is linked to their hearing. So it is really, a lot of people wonder, why on earth do the physical therapists have an audiology sitting around? So what I do is give them the testing and the information. Oftentimes a person will come maybe from an ear, nose, and throat physician's office or something, and they're dizzy, but we don't really know why. So the testing that we do will pinpoint where the problem lies. And then at that point, they can take that information and further evaluate and treat them. So basically that's the connection and we are also seeing lots of situations where, let's say somebody does have a hearing loss and they have a balance problem. They're showing results that if somebody wears hearing aids, then their balance improves. So we really want, or oftentimes probably our most difficult people are people maybe have suddenly lost a hearing in one ear and not the other. Well, now that brain is really confused. So we try and correct that, but absolutely hearing and balance are very, very related. And it really just is my job to provide that testing. So,
yeah. And how would you say that hearing loss affects other aspects of people's lives?
Well, look at COVID now. It's very evident that people don't hear are wearing masks. They rely on watching people. They also wear hearing aids. So when they take their masks off, oftentimes their hearing aids fall out. So this has been a very challenging time for people that don't hear. So we have to be aware of that. Also, we're learning more and more about the connection between hearing and memory loss. People that have hearing loss, they say, wait 7 to 10 years before they actually do anything about it. Why do people not want to wear hearing aids? They think it's for old people. They think they don't work. There's they're expensive, all kinds of negative reasons. But when they don't, we're finding that it has a tremendous effect on their life. You know, kind of the old adage, if you don't use it, you lose it. If you don't keep your brain stimulated with the sound, then what happens is they are clinically showing cognitive delay and memory loss. So really, really important that if people have a hearing loss, they really do something about it. So we're here to do that as well. We age as well as do vestibular testing.
So important to go and get a baseline test for your hearing.
Absolutely.
So that these guys have something to compare it to. I can't emphasize how important that is. I actually had a baseline done for myself. Hearing loss really does kind of run in my family. My mom was wearing hearing aids in her late 40s. So definitely go get that done, because it's something that Dr. Berry's going to need to see when she's assessing you for sure. Yeah. All right, Dr. Hinds, how are you?
I'm doing well, thanks.
Good, good. Now, there are some statistics out there on falls and deaths that are related to falls. Why is it such a serious concern for our senior population to have that flexibility and balance training?
Right. So kind of what you're hearing from everybody else so far is there's a lot that goes into your balance. You have 3 systems that you use to maintain your balance. Your hearing is a crucial part. But what we also have to consider is that a lot of things as we age naturally begin to decline, or we have issues develop, both orthopedic wise and also neurologic wise. If you just think of natural conditions that we see on a daily basis, I mean, we talk about your visual system being used to maintain balance, things like macular degeneration, glaucoma, visual deficits in themselves, that all already puts you at a disadvantage because now it's affecting your use to use your visual system. That is something that becomes much more prevalent as we age naturally. And so as our community ages and the baby boomers continue to age, we start seeing more of these type of conditions that directly impact your balance become much more in the front running. We also see things with the sensation. Dr. Reed had mentioned peripheral neuropathy. You know, we have idiopathic versions of that. It could potentially come from your lumbar spine. It can be coming from diabetes. We see a lot of orthopedic conditions, so total knee replacements, hip replacements, plantar fasciitis, just muscle weakness in general. All of these things impact your ability to maintain an upright posture. It influences where your center of mass is, and it greatly disrupts your ability to use your balance reactions. And your balance reactions are the main thing that are going to stop you if you do happen to trip or lose your balance. The ability to react with those reactions and to do so quickly is what will stop you from actually falling and potentially ending up in the ER due to a fall-related injury, which is what we just continue to see more and more often just as the population ages. So there's just a lot of things that naturally come with age that influence how we use our balance systems. And so I think that's why right now it is as significant as it is. And will continue to be, you know, as we go forward. It's just knowing that there's a lot of things that we can do to address all of those issues that currently might truly be impacting your ability to maintain equilibrium.
Yeah, and I think that a lot of folks, there's a misconception that it's normal for people to fall as they age. That's not normal. And much like Dr. Berry, you know, when I'm talking about getting your baseline hearing test done, you measure and analyze and do a fall risk assessment. So talk to me about what that fall risk assessment is and how critical it is that someone get that done.
So we believe that it's extremely important. We will try to have people come in, even if you're not experiencing balance issues necessarily, come in, let us get a baseline. Let's see where you're at. Let's see if we can potentially get ahead of the curve, right? And fix potential issues that could further down the line lead to something like a fall. We have a few types of assessments that we can do within our clinics. One of them actually involves a pretty big machine that has the capability of making the walls and the floor move. It's known as a neurocom. It's one of the best tools that we have within our company because it really allows us to isolate how the balance systems function independently, but then how they function collectively as a group. And so it really allows us to narrow down where the issues are. But we highly advise everyone come in. If you're playing sports, right, you can be at a little bit of an increased risk for falling because you're constantly moving, having to change position very quickly. You have to react very, very quickly. And so just a few tests that we do can really help determine if you're at a risk. And then if you are, we can help get you ahead of the curve so that we can stop you from falling in the future.
Absolutely. And talking about exercise and physical activities, that's going to lead us right down to Mike Compton. Why is it important for seniors to follow a specific exercise program? And what type of exercises should they be doing and not doing?
Definitely. It's one of those things, no matter what age, you are, everyone should be following an exercise program to some degree. This is one of those things that at this point of where we're at, the World Health Organization has reported about 3.2 million deaths are attributed in some way to physical inactivity. And that can be related to the diseases and conditions that go along with having that impaired physical, aspects.
Sure.
So, it's important just so, seniors follow some sort of exercise program, because a lot of problems and conditions that, they're currently experiencing now with balance, hearing aspects, following that exercise program will help improve, in those areas. And kind of a lot of areas where, we see seniors kind of lacking is, issues, or not lacking, but have issues in different, underlying health issues, can relate from bone health to cardiovascular strength and to issues with the heart. Inactivity leads to, issues with dementia later on. Having, stronger bones or stronger muscles can actually decrease the risk of falls, which is, again, a big aspect that they run into later on in life. It can lead to a better increased range of motion, better quality of sleep, overall improved mood. At the end of the day, exercise really is medicine that can help a lot with the different aspects that, baby boomers are dealing with at this point in kind of their age. As for exercises, it's one of those things that we do specific consultations with everyone. Everyone is so different. We do have recommendations on, a standard of what they should be doing kind of minimum in a week, but everyone is different at that point. So they might be dealing with certain issues, other people might not be. So, we like to work with everyone really one-on-one and really assess kind of where they're at and what movement should be good or shouldn't be good, for them at the end of the day.
Now, I understand you have a couple of just easy things that people can do when they're at home, maybe when they're waiting for the microwave to go off. Do you want to exhibit any of those or talk to us about simple exercises that we could be doing?
Yeah, definitely. One, a very simple one is a simple air squat, which I can demonstrate here and just kind of talk about a couple, touch points. And, at that point, if someone is waiting on the microwave, they could knock out anywhere from 5 to 20 reps, depending on how they're feeling and how their bones and joints are moving. So I'll demonstrate that right now really quick. Let me back this up. But with an air squat, again, this will help improve different aspects of the quads, hamstrings, and glutes. And we tilt that down just a little bit so you can see my full range. Now, goal here, feet should be shoulder width apart. Chest is going to stay nice and tall. The goal here is to turn your feet out just a little bit. And as you descend down, the first thing you want to do is let those hips come back first. And again, as you descend down, letting those knees go to the outside, keeping those arms and chest nice and tall, descending down as low as you can get. Again, nice and smooth, popping up using those hamstrings and glutes. Again, a side profile, letting those hips come back first. Nice and smooth down, keeping the chest nice and tall, and standing up all the way through. So the goal is, again, to get down as low as you can, but again, depending on where your mobility is at, as long as you're not feeling any pain in the knees or hips or glutes, you're good to go.
Okay, we won't have everyone stand up and demonstrate, but that was fantastic. Thank you, Mike.
You're welcome.
All right, last but certainly not least, we have Dr. Hamer, and he is the National Director of Education. Is that right, Dr. Hamer?
It is, yes.
All
and
right.
So we have 3 sort of divisions, 3 sort of concentrations. One is balance, which you heard about, and then we have orthopedics and pelvic health. So my job is to coordinate that and provide the orthopedic program. So they work and dovetail together. And as Dr. Reed talked about, Dr. Hinds, is balance is your sensory system, which could be affected by your total knee, because no longer is your total knee telling you where you are in space as much as it used to before you had that knee replaced. And then tying in, so then that's going to affect balance. So orthopedics is a very important part of that.
Yeah, and that's one of the questions I had for you is what type of services does a physical therapist provide in this day and age here in 2021? And I think you looped it in really well there. So another question I have for you is how can physical therapy help people avoid surgeries and prescription medications? I know for myself, I would love to hear the answer to that.
There's a few studies out there, and one of them was looked at the amount of opioids needed for total hip patients. And they found that if they had physical therapy before they had their total hip, the amount of medication they needed after the total hip to control pain was less. We see it in the younger population. There's a big difference in the recovery rate of ACLs if they've had therapy before, because when you're in pain, you have the bandages on and crutches is not the time to learn how to do these exercises. You should have done that beforehand. So as far as physical therapy is concerned, it's a lot of education and just sort of building upon that. And yeah, that's sort of where we're going.
Yeah, and for someone that considers themselves to be healthy, why would they consider physical therapy?
So the question to ask them is, do they want to be more healthy?
Yeah.
So what is healthy? And it's not even perhaps increasing what you have, but as we get older, of course, you have to put more effort into maintaining what you have. And I love the analogy of, you have water in the bath and it's leaking, but the older you get, you got to keep putting more water in just to maintain the level in the bath. So by the time you're 90, you're working full time to keep that body going. So it's important, I think, to have very specific programs, ones that are safe for you. And that's sort of what Mike alluded to, that are age specific and then address your real problems. And what we see, and one of the parameters that, or one of the data points we use, is your sit to stand ability. So if you're sitting in a regular chair, can you cross your arms and can you stand up, say 10 times? Or do you need to be able to push off the chair? So what will happen is the person gets weaker, so they start using their arms, they're using their legs less, so they're just actually reducing down, and they don't realize that that's, one day then that's going to be a real problem for them. So to maintain their lower extremity strength is important. And then actually what I did, and my wife did, I came on board with Physical in 2017, and we did a baseline balance test at home, which was sort of standing, doing what we call 7 head positions. The first one is looking straight ahead. Number 2 would be up, number 3, number 4, number 5, 6, 7. And then, so that's testing and challenging your inner ear with your canals. So can you do that with your eyes open, wide base? Can you do it with your eyes closed, wide base? And then the progression, of course, would be to have a narrow base. And I videoed myself doing that. So now I have a baseline and I can tell whether I'm digressing or not. So getting back to your question, there's always room for improvement. And as you get older, we need to put more effort into just to maintain.
Yeah, absolutely. And I love how you loop everything together. And I want to ask if you have any closing remarks that can tie all of these pieces together before we wrap up today.
I think what you see is that with the team here, we have something very comprehensive, which isn't really offered anywhere else, along with some really good safety features. We have an overhead support system. People will go into it and we'll get them to sit down and they can prove that they can't go any further than that. So that then gives them the confidence to work and make their exercises more effective, because they are going to be at a level which is actually going to improve them at a faster rate.
Perfect. Well, thank you so much for joining us today, all of you. I appreciate your partnership with Seniors Blue Book and the education that you provide to the community. These services are invaluable, and you're absolutely right, Dr. Hamer. You do have a comprehensive list of services that can get anyone through an injury or educate them before they have a surgery. I think that that's really great advice. You're right. When you're laid up, that's when you're not needing to learn the new skills. You need to know them first. And I wish I'd known that before my multiple foot surgeries. Well, thank you all so much for coming on today.